Hello, my name is Dr. Po-Ju Lin. I'm a postdoctoral associate working at Wilma Cancer Institute, University of Rochester Medical Center. I'm here to present in my secondary analysis using landmark phase 3 randomized control trial data collected from Dr. Karen Martian. We are using the yoga intervention on sleep and cancer-related fatigue in cancer survivors. So what unique about cancer-related fatigue is that it's not like regular physical fatigue. It can be sleep or rest away. And often sleep disruption and cancer-related fatigue often co-occur in majority of the cancer survivors. So we propose this mediation model adding yoga, cancer-related fatigue, and sleep quality into a model to study the direct effect of yoga on cancer-related fatigue and also the indirect effect through improving sleep quality on cancer-related fatigue. Quality is evaluated by several subdomains, and among those subdomains, daytime napping plays a major role. So we analyze another mediation model using the daytime dysfunction with daytime napping into consideration, and to again study the direct effect of yoga on fatigue and through the indirect by reducing daytime napping. Sleep disruption and cancer-related fatigue are the two troublesome side effects experienced by cancer patients and survivors. A majority of the cancer patients experience these two side effects at the same time. But we do not have a good understanding how those two side effects relate to each other. So for our phase 3 randomized control trials, we use a standardized 4 weeks group yoga program to study the effect on sleep and cancer-related fatigue. The data I'm presenting today, I'm using the data collected from 321 study participants. Majority of the study participants are breast cancer survivors. They were consented and recruited across the United States from our University of Rochester Cancer Center NCORP research-based clinical trial network across the United States from 12 out of 22 NCORP sites. They were randomized to either standard care arm or our yoga arm. And after 4 weeks of the intervention, we measure their sleep and the fatigue at baseline and also the post-intervention. The yoga intervention we use is a standardized yoga program designed by Dr. Karen Martian. It includes gentle hatha and the restorative yoga. And each session includes physical alignments, postures, breathing exercise, and a mindfulness exercise. And each session is 75 minutes long and 2 times per week. The whole program is 4 weeks long. To standardize the same content delivered to each yoga session, the yoga instructor or Yoga Alliance certified. They were also trained one-on-one by our yoga consultant. They will also provide with instructional manual and the DVD. So we found a yoga effect on the sleep quality, also the daytime dysfunction. I did not mention the daytime dysfunction earlier, but daytime dysfunction is a subdomain to evaluate the overall sleep quality, and it's played a major role affecting sleep quality and also the fatigue. So after 4 weeks of intervention, we found yoga significantly improve overall sleep quality, reducing daytime napping, and improve overall fatigue level. But the interesting and novel finding is that when we put sleep quality and the cancer-related fatigue into a mediation model, we found a significant mediation effect, which like 22% of the yoga effect on improvements in cancer-related fatigue was mediated through improvements in sleep quality. And when we put the daytime napping, which is a subdomain to evaluate overall sleep quality, mediation effect was even higher. 37% of the improvements in cancer-related fatigue was mediated through reducing daytime napping. I would like to particularly emphasize that the uniqueness of the cancer-related fatigue is that it's not like regular physical fatigue that can be sleep or rest away. So our data also suggests this uniqueness, like by adding yoga practice into participants, like cancer survivors' daily activity, actually help them to remain more active and sleep less during the day, and they then feel less fatigue. And that's supporting the uniqueness of the cancer-related fatigue that cannot be sleep away. And our data is actually suggests that they sleep less during the day and feel less fatigue. We think clinicians should consider to prescribe this, like our yoga program to cancer survivors who experience both sleep disruption and cancer-related fatigue. Our program is 4-week long and is low-risk, non-pharmaceutical treatment, and it shows significant effect.